Good morning. I'm George Little. I've been asked to represent the professional associations. I'm also representing the American Academy of Pediatrics and the International Pediatric Association, and I'm a father. Al has said in 3 minutes to do a lot, so I decided to, on the meeting side of it, just put out some descriptors. This meeting's been important, timely, on target, organized, stimulating. So stimulating it's been tiring, at least for me. It's too short. I wish it had gone on, but I'm not sure I'd have the energy level with all the stimulation that's been going on. It's bridge building, it's interactive, it's been informative, evidence and data driven, it's been excellent, it's been memorable, and I would suggest, as somebody said on the first day, it is in fact historic. Now, professional associations come both on the clinical side of the spectrum, where I went from, the public health side of the spectrum, and so forth. They do many things. Professional development of the individuals is only one. They maintain and push for clinical excellence. They are system development agents. They are advocacy agents. They are behind and represent both the very positive public will and sometimes the negative public will, we're all sorry to say. But they're extremely important, and they're growing and they're dynamic. And I would like to just point to the Helping Babies Breathe thing as something that grew out of a professional organization. I'm proud to say that as a volunteer for the American Academy of Pediatrics, I don't get a paycheck from the American Academy of Pediatrics, but I've put in 40 years of volunteer work with them, and that activity of HBB is to me a prototype of what can and should happen, and then move on into the public-private sector aspect of things and so forth. It'll be around for a long period of time because the American Academy of Pediatrics is going to continue to work it and be the point of reference for it as it works with other organizations across the world. It's also going to spread out from there into the issue that many of you have identified that I've heard here of the whole business of integration with ENC and so forth. So that's an example of what happens, and I anticipate there'll be a lot more of that in the future. And speaking of the future, because Al said, well, let's look at the future a little bit. I'm not worried about the future dynamism of professional organizations. Part of it's driven by the globalization, the communication, and everything else that we see behind us, but part of it's driven by the young people who are coming up in the professions. And this week, I've received 2 emails from young physicians who want to know, how do I do things globally? The energy within the pre-service sector these days in nurse midwifery and in nursing and so forth is definitely over into the involvement in the global way like it never was in the past. And if our professional organizations in the present state don't do what many of them are, FIGO, Academy of Pediatrics, et cetera, CNMs, then those young people are going to make us do it. Thank you very much.